My name is Elizette Rodriguez. I also go by Ellie. I'm a proud first-generation medical student from Miami, Florida. My journey into medicine has been a combination of curiosity and desire to make a positive impact. I currently study at NSU KP Com, and together we can elevate med. My father, who was once filled with love, became permanently disabled after a hit-and-run accident. His anger, fueled by his struggles with his new disability, led to abusive behavior and eventually homelessness. And despite these hardships, my mother worked tirelessly to raise 5 children and served as my role model. And even though my childhood was challenging, I don't see it as a sad story, but I see it as one that fueled my resilience, my resourcefulness, and my deep desire to help others. I learned firsthand how impactful community support can be, and I carry that lesson with me. And through volunteering with underserved communities, I realized that medicine is where I can make a meaningful difference. Medicine allows me to combine my passion for service with my commitment to empowering those who, like my family, face significant obstacles. My experiences drive me to help others find hope and strength in adversity. My passion for obstetrics and gynecology began the first time I stepped into a delivery room. There's something very powerful about holding a woman's hand during one of the most vulnerable times in her life and reminding her of her strength. Through my clinical rotations, I've been able to work with women who have had zero prenatal care in their 3rd trimester, and women who come to the hospital and don't speak English and only speak Spanish or Haitian Creole. And in those moments, I've seen how powerful a simple "tú puedes" or "ukapafesa" can be. It really makes all the difference. And so for me, OBGYN combines my passion for women's health, advocacy, and hands-on care. And it's where I feel that I can make the biggest impact. And also through my clinical rotations, I've learned that my talents extend beyond my medical education, but they lie in my ability to connect with patients and advocate for them. And whether that be holding a patient's hand through labor or going to different facilities in South Florida and educating women on cervical cancer prevention, my ultimate goal is to make others feel seen, heard, and supported. So moving forward, I plan to expand outreach efforts like my HPV education programs or health fairs for underserved communities while mentoring first-generation students and helping them navigate challenges that I once navigated. It's a movement that's redefining the face of medicine and proving that your background does not define your potential. And as a first-generation low-income student, I know what it feels like to look around and wonder if you belong in this space, to feel alone or to worry that you might not make it due to financial barriers. And for me, ElevateMeD represents a community of people who believe in me and believe in others like me. And I want to be part of this family. I want to learn, I want to grow, and I want to one day be able to turn around and uplift the next generation of underrepresented doctors. I want to say thank you. You're changing lives in ways that you may never fully see. And you're not just funding education, but you're fueling dreams and you're breaking barriers. And you're also giving students like me a chance to step into spaces that we've fought so hard to reach. Your investment in students like me helps level the playing field, and it ensures that the future of healthcare providers will bring diverse perspectives and compassion and innovation into the field. I'm deeply grateful to be part of this mission, and I just want to say thank you. Thank you for your time, and thank you for listening to this.